So, we're going to dive into the huge world of global health today, but we're looking at it through a really unique lens. We're going to explore the powerful and honestly often overlooked role that faith plays in building these bridges of healing all around the globe. I love this quote. It's such a great way to kick things off. BKS Eaniger says, "Health is this complete harmony of the body, mind, and spirit." And that's so true, right? It's not just about not being sick, it's about this deeper, holistic well being. And keeping that big idea in mind, well, it's absolutely crucial as we start to zoom out and look at health on a worldwide scale. Okay, so what happens when that harmony isn't just a little off balance, but is completely shattered on a massive global scale? When entire communities don't have clean water, or when diseases we know how to prevent are just tearing through populations. What happens when basic healthcare is a luxury instead of a fundamental right? Well, that right there is the reality that the world of global health faces down every single day. And when you're facing challenges that big, you've really got to know your why. Why should we care? Why does this matter? For so many people involved in this work, the answer isn't just about logistics or medicine. It goes way deeper. It's a fundamental call to compassion. Okay, I want you to stick with me on this analogy because it's going to help us through this whole explainer. Picture the world's health systems, right? Think of them like a massive, sprawling network of rivers. Some of those rivers are flowing strong and clear, bringing health to everyone around them. But other rivers, they're blocked up or even polluted. And here's the thing. When one part of that river system is in trouble, it affects everything downstream. Now, in this picture, faith-based groups often act like a bridge. They span those troubled waters, connecting communities that might otherwise be cut off. And they help channel resources to the places that need them the most. It's a really powerful image. So when we throw around the term global health, what are we actually talking about? Well, at its core, it's this incredibly powerful idea. It's the mission to improve health. And, this part is key, to achieve equity in health for every single person worldwide. I mean, talk about a huge, ambitious, and just unbelievably important goal. And for a lot of folks, especially people of faith, getting involved in this stuff isn't just about, doing a good deed. It's way more than that. It's a moral imperative. It's a call to action that's rooted in a deep desire for justice, for real compassion, and for bringing actual tangible healing and restoration to the world. All right, so we've got our why pretty clear. Now, let's get into the what. I know the whole global health landscape can seem like this super complicated, tangled mess of acronyms and organizations, but don't worry, we're going to break it all down and make sense of it. Okay, first things first, let's tackle a question I hear all the time. What's the deal with global health versus public health? People use them interchangeably, but they're not the same thing. Nailing down this difference is really going to help us see the bigger picture. Here we go. This lays it out perfectly. Think of public health as being focused inside a country's borders. It's like managing your own local part of that river network we talked about. But global health, that transcends borders. It's about the big stuff, pandemics, access to medicines, climate change, issues that don't care about passport control and affect all of us everywhere. So one is focused locally and the other is truly global. So who's in the middle of all this? Well, right at the center of this huge network is the World Health Organization, the WHO. They're the big one. They're the leading international body that helps coordinate everything, funds research, and sets the standards for how countries should approach health. You could almost think of them as the air traffic control for global health. So how does a group like the WHO even begin to figure out if a country's health system is working? Well, they use this framework, these 6 building blocks. And honestly, it's brilliant because it applies everywhere, from a massive city to a tiny village. You need all of these things working together. You need service delivery, a solid workforce, good information, the actual medical supplies and tech, the money to pay for it all, and of course, strong leadership to steer the ship. If one of those blocks is shaky, the whole thing can crumble. Okay, now that we have the big picture, let's zoom way in on a really specific, and I mean vital, part of this whole system, the role of faith-based organizations. And I really want to stress this. We're talking about way more than just charity work here. We're talking about a critical, strategic partnership in making global health actually happen on the ground. There's this idea out there, a pretty common misconception, that these faith-based organizations, or FBOs, are kind of small-time players. Just another small cog in this giant machine, not really making a huge dent. But yeah, that could not be more wrong. Here's the reality. So often these FBOs are the critical link. Why? Because they're already there. They are on the ground in communities that big governments or giant international NGOs might struggle to reach. They've built up trust over years, sometimes generations. They already have the infrastructure. In fact, in many, many places around the world, they are the main healthcare providers. And on top of all that, their voice in advocating for better policies is absolutely essential. So just to be clear, when we say faith-based organization or FBO, what are we talking about? It's pretty simple. It's any group whose work is motivated by their religious beliefs and principles. That motivation is like their engine. It's what drives them to provide health services, to speak up for people who don't have a voice, and to build up those strong community support networks. And a lot of these groups look at the world through what you could call a justice lens. It's a really interesting idea. It means that for every single decision they make, every policy, every program, they're filtering it through these core principles of justice and mercy. They're always asking themselves those hard questions. How is this going to affect the most vulnerable person? Is this actually fair? Is this the compassionate thing to do? It's a really powerful way to make sure their work is having the right kind of impact. Which brings us right to our final section. It's time to turn all this understanding into action. We've talked about the why this matters and the what of the system. So now let's get practical and talk about the how. How can you get involved and help build one of those bridges we've been talking about this whole time? Honestly, it doesn't have to be overwhelming. It really comes down to 3 clear, powerful steps. First step, learn. Just take some time to really get it. You could even start by reading up on that WHO framework we looked at. Second, connect. Find a group. It could be local or global that's already doing this work on the ground, and just engage with them, learn from what they're doing. And third, and this is huge, advocate. Use your voice. Support policies that are designed to protect the vulnerable. Every single one of those steps is a real way you can start building a bridge. So, as we wrap up, what are the big things to remember? Let's boil it down. First, global health is all connected. What happens on one side of the planet can and does affect us all. Second, policy isn't just paper. These decisions have real, sometimes life and death consequences for people. Third, nobody can do this alone. Collaboration is everything. And finally, in that big collaborative picture, faith-based advocacy isn't just a nice to have, it's a truly vital part of the puzzle for achieving health equity. Look, the system is huge and the problems can feel overwhelming. I get it. But the mission is crystal clear. It's about pursuing healing, dignity, and justice for every single person. So the only real question left is the one right there on your screen. Where will you help build a bridge? Thanks so much for digging into this with me.